Good afternoon, this is Tyler Brock with Siouxland District Health Department, and we just thought we would take a couple of minutes today and give everybody, I guess, what I'd consider kind of the latest updates on the things that are going on in Woodbury County with COVID-19. We know that it's on everybody's minds right now, and so we're going to try to do this. This is a little bit different for us. We're going to try to do this on a daily basis, just giving some updates and kind of focusing in on a topic that we seem to be hearing a lot about, getting a lot of questions on. So today, just wanted to start out with the fact that a lot of you may have heard that we have had a second reported case of COVID-19 here in Woodbury County, so that makes two. We got both of those over the weekend. We usually find out about these in the afternoons, so a lot of times when we're reporting on those, we've actually found out about them probably the day before. So we're going to try to do this on a daily basis where we're giving an update as to any new cases that we might have gotten. So we're going to try to do these kind of updates like this. But today I really wanted to focus on how we handle these cases. Both of our cases that we've had so far are recovering at home, they're self-isolating and that kind of thing. So what are we doing with these cases, and how are we making sure that the cases and the people that are close to them aren't infecting other people? Well, the first thing that we're doing, anytime someone is diagnosed as a case, they're being isolated, okay? They're being isolated at home in most cases, and they're asked to do this for until they are 72 hours fever-free. And when we say 72 hours fever-free, we mean no ibuprofen, no Tylenol that is keeping the fever down. So 72 hours with no fever, and any other symptoms that you have, like that cough or the shortness of breath, those have to be improved, and it has to be at least 7 days at least 7 days since your symptoms began. So those are the things, and people who are cases have to be isolated until all three of those criteria have been met. In addition to that, their household contacts, the people that are closest to them, they have to what we're calling self-isolate for up to 14 days after their last exposure to the person. All this is being done in an effort to make sure that people who are infected and those that are closest to them are not out in the community potentially infecting other folks. So, because we've gotten some questions, how can we be sure that we're not going to run into these cases in the grocery store or the people that are closest to them? And this is why. This is how it happens. They're isolating at home, and that's going to be the main thing that we're going to be looking at. And we do this for every single case. Now you might wonder, okay, so why are we just focusing on household contacts? What about the people that they might have shopped next to? What about the people that they work with and things like that? We acknowledge that there's a wide range of potential when it comes to spreading this virus, but the vast majority of cases are being spread by close, prolonged contact, okay? Even in work settings where you might be working with someone for 8 hours a day, very rarely are we, right face to face with someone. There's almost always a little bit of personal space in between folks. So work contacts, while they might not be zero, they're low, okay? And the same would go for any other type of casual contact where a friend or something like that you haven't, that you'll spend some time with, but they haven't had that close personal contact. Although we do reserve, there's always some exceptions, and when we contact these cases and we start talking about the people that also might be at risk, we're gonna go down that road as well and start recommending isolation for other folks. One of the things that is really being targeted in Iowa right now is isolating people with the symptoms regardless of whether they've been tested or not. So even if they're not a confirmed case, they're going to be considered a suspect case if they have a fever and cough or shortness of breath. If they have that combination of symptoms with or without testing, they are going to be considered a suspect case, and they're going to be put in the same kind of isolation procedures as the person who actually had the test and is confirmed. We're going to treat them and their contacts the exact same way. So it really is important. The things that we do behind the scenes when we have cases are all intended to keep sick people from infecting other folks, and these isolation procedures that are in place go a long ways to that. The other thing is the social distancing thing the principles that have been put into place these last few days are really, really important. So keeping that distance between folks, limiting your face-to-face contact, limiting your interactions with large groups, that's going to go a really long way to reducing the likelihood that you're going to come in close contact with someone with COVID-19. And we can't stress it enough to some of the personal hygiene items that we've been talking about forever. The hand washing, covering your cough and sneezes, avoid touching your face and eyes and mouth, and most of all, staying home when you're sick. I know, we've to be honest with you, we've kind of gotten criticized the last couple of days for just continually to promote those as if that in and of itself is enough. And we acknowledge that those things aren't all that by themselves enough to prevent all disease. So we're using these things in combination with the social distancing, in combination with the isolation of cases and the isolation of close contacts. So it's a mixture of things that are being attempted here. And some of them are things that the health department can do, but a lot of them are things that just we as citizens need to be doing to help out with the community spread as this goes on. So there's a lot of other things that we can talk about, but this is what our focus is going to be on today. We'll do some more updating tomorrow if we have any additional cases and we have any additional items that we need to focus on. Until tomorrow, thank you.